Hello and welcome back to my YouTube channel. How are you doing? Karibu sana to a brand new video. Videos come in every Tuesday and Friday, and I hope that I am making you learn something new with every one of my videos. So today I am going to tackle one of the frequently asked questions that I get, and I don't know, I think I keep postponing this video. Okay, so that video is all about HIV treatment, or rather the ARV side effects, because it is one of the most requested videos that I have ever gotten. Okay, so we all know that right now there is no treatment for HIV. So far, all we have are the anti-retrovirals, which are basically like life-prolonging medication. And there are over 40 ARV regimens across the world. They're taken differently. Some people take like 6 medications a day, some 4, some 2, some 1. Like I am on the when 24 hours. 1 tablet. Okay, however, when we started, we used to take like 5 or 6 tablets. So as time has come by, things have changed, the world has evolved, and that is why I keep telling you, have the right information about HIV, because there are over 30 million people in the world living with HIV, and trust me, one of them is somebody you know. Just because they haven't told you doesn't mean that you don't know that person. So far, we have made some steps, including the fact that there's going to be introduction of an injection, which is a very beautiful thing, I think, for people like us, or sometimes who have been victims of drug, not resistance, but defaulters, serial defaulters. I think it's going to be something beautiful for us. Okay, so now I want to talk a little bit about ARVs side effects. Okay, so there's the short term and long term. Okay, so most of the short term are very mild. They disappear between 2 to 6 weeks after somebody has started taking their medication, because I noticed a lot of people who actually come to talk to me and tell me they have not started medication because they fear the side effects. So I'm like, how are you fearing something you've not even started? Remember, every medication has a side effect. Even too much aspirin causes your blood to become thinner. Okay, so everything has a side effect. So all I'm just trying to tell you is, don't let a restored quality of life be ruined just because of fear. Okay, and starting ARVs has nothing to do with acceptance. It has more to do with your self-will. Okay, so I'm going to read some of them. Okay, so milder side effects always go away soon, which are now the short term. If not, because the people who come to me and tell me the side effect, they started ARVs 2 or 3 weeks, the side effects are not going away. So if the side effects don't go away, go back to hospital and tell the healthcare provider that your side effects have not gone away. Because trust me, you can't start ARVs and then they just align to your body, bam. No, the body has to have that resistance, and the ARVs have to fight back. And trust me, the person who is actually feeling the pain is you. So if it continues over a long period of time, go to hospital and probably have a regimen change, or the doctors will know how to fix it. Okay. First of all, I would not recommend you for people who actually experience nausea and vomiting, which is a mild side effect. I would recommend, don't take your ARVs on an empty stomach, because if you do, then you trigger the nausea even more. Okay, and some people who take, and if it causes you like insomnia, because like the DTG regimen has insomnia, and that is why it's meant to be taken in the morning and not at night. Because if you take it at night, trust me, you're not going to sleep. There is no sleeping for you. You and sleep not in the same water. So some of the more common side effects are nausea, appetite loss, Appetite loss. What might help with the appetite loss is eat several small meals per day instead of 3 large meals. So instead of eating breakfast, lunch, supper, eat small breakfast, brunch, lunch, something in between lunch and supper, and then supper. So eat smaller meals, a lot of fruits and vegetables, of course, so that your appetite might increase. If the appetite does not come back, it will be, and you can afford to buy multivitamin medication, buy them, because there was a time we used to be given multivitamin medication for free, but nowadays it's not being given. Lipodystrophy. This actually used to happen to some of us. For me, it happened on my legs. For some people, I see in different parts of their body. Lipodystrophy is a condition that causes people to lose or gain fat in certain body areas. This may make some people feel self-conscious or anxious. This one, it was a very common side effect for people who started ARVS. Some of them experienced it, some did not. I experienced it because my legs used to be looking very nice, and then now they're not. So, and some people, they have like a bigger upper body, some have a bigger lower body, some have central obesity, because it's all caused by the medication. However, it's fixable because it's short term, okay? What might help with the lipodystrophy is more of fats combined in different places. So what might help? Exercise can help reduce body fat from the whole body, because I have actually seen people ask me this question on why their bellies are becoming too big. It is a side effect of the ARVS. So exercise, okay? Exercise can help reduce body fat from the whole body, including the areas where the fat has built up. An injectable drug called tesamorelin may help reduce excess belly fat in people who take HIV drugs. However, when people stop taking tesamorelin, belly fat is likely to come back. They are even suggesting liposuction. I am not suggesting this. There's also diarrhea. Okay, diarrhea, I think it's the most common side effect for people who have just started ARVS. It is the most common. If you're not diarrheaing, you're vomiting. So you can eat fewer greasy, spicy meals, eat fewer foods, like reduce so that you can eat smaller amount of food, and then you can also try to control it by over-the-counter medication, but always seek medical help before you do that. Fatigue is a side effect of HIV drug treatment, but it is also a common symptom of HIV. So it's just because and please don't come and tell me, oh, I have been feeling tired, do I have HIV? Not really, just it is a common side effect. Okay, fatigue happens to everybody, so it is fatigue. In fact, fatigue is like a side effect and a symptom to very many things. So don't just assume. Okay. There is something that I am trying to find here. There's mood changes. This one I have seen it with somebody. I will not mention them, but I have seen it. Mood changes, depression and anxiety, they happen. So, mood changes including depression and anxiety can be a side effect of HIV drug treatment, but mood changes can also be a symptom of HIV. Yeah, trust me. And when I say this, is because I have seen it happening, okay? Firsthand. And especially people on actually drugs that may cause this are efavirenz and dolutegravir. I just try calling it DTG because I cannot pronounce that name. Okay, so there's nausea and vomiting. Of course, I had said that from the beginning. And now, There's the insomnia. I said insomnia because insomnia comes with it. So there are other side effects. These are what I was looking for. Hypersensitivity or allergic reactions, which with symptoms such as fever, nausea, and vomiting. So there's the hypersensitivity part. There's bleeding. There's bone loss, heart disease, high blood sugar and diabetes, lactic acidosis, kidney, liver, or pancreas damage. Most of the time when you're given HIV medication, you are told avoid alcohol as much as possible because the long-term side effect is liver, kidney, and pancreas failure. And alcohol is mostly processed in the liver, and so are ARVs. So when they go and they meet there and collide, they end up depleting your liver faster than you thought. So as much as these ARVs are giving us quality of life, they also come with their own burden, which means there are things such as smoking and drinking of alcohol that you need to leave behind. There's also numbness. Actually, I've seen some people complaining about this to me. I never knew it was a thing until right now. So there's numbness, burning or pain in the hands or feet due to nerve problems. So it also does cause nerve problems. I have never experienced this, but if you have, kindly share it with me on the comment section, okay? So what I can help you with right now is when you start ARVs, you also have to make some really tough health choices. You have to stop taking things that are too sugary, because if you look at my face, a part of my face became swollen last year, and the swelling has not gone down up to right now. When I touch it like this, I actually can feel the swelling. I was told not to take sugary things. I am still taking sugary things. So anyway, all I can tell you is you have to make tough healthy choices, because HIV comes with a compromised immune system, which means that any other health condition is bound to attack you sooner or later. So all I can tell you right now is be careful, eat healthy, ensure that for every one of your meals there is a fruit and vegetables. Let those ones be more. In fact, just eat fruits and vegetables. Okay, it's just that you need a balanced diet, but it's better when the fruit and vegetables are way more than anything else. If you cannot afford like buying a whole fruit basket, you can always have like 20 shillings, you buy like 3 bananas. The following day you use another 20 shillings, you buy like a watermelon. Another 20 shillings, you buy pineapples. So for every day you eat a different fruit, but the fruit is benefiting you. Vegetables such as kale, however, I'm going to address this in my nutrition video, but vegetables such as kale, spinach, traditional vegetables, the managu, the mrenda, the mchicha, the pumpkin leaves, those ones help a lot in building of the immune system. Replace sodas with smoothies, healthy smoothies, okay? Replace snacks with carrots and cucumbers, because carrots and cucumbers are some of the best immune boosters and fat reductors. They reduce fat or cholesterol in the body and they build immunity. So even things like homa won't be catching you easily. So please, and for me, let me not address that here because it's already taken care of in my nutrition video. So please ensure you stay a healthy life. You are yes on ARVs, but you also need that long and healthy life so that life can move on. And also exercise. This medication has a lot of toxicity. So if you just take them and you see it, you'll end up reaching like 150 kgs just like that, because for some reason the ARV medication has massive weight gain. So you must exercise. Must. That one is not an option. It is a must. Be physical, walk, skip rope, jump, go up the stairs and down. Just do something. Ensure that you are involved in one physical activity or another. I am advising you like this, and I am the most inactive human being alive. However, I am going to change that. Okay, so thank you for watching this video. I truly appreciate your support. Continue liking, sharing, and subscribing. Thank you so much. See you in the next video.